Americans are questioning how asymptomatic Mike and Karen Pence got tested for coronavirus just hours after urging Americans not to seek testing unless they were showing symptoms.
The Vice President and Second Lady announced over the weekend that they tested negative for the coronavirus after a member of Pence's staff tested positive for the virus.
"I'm so confused. Did Mike Pence just address America saying we should not ask for testing if asymptomatic? We need to save tests for people who need them? Even if exposed people can't just get tested, you have to have symptoms, all of them. But he and his wife are being tested." Vicki Cornell, the co-founder of a nonprofit that helps at-risk children, tweeted Saturday afternoon.
During a press briefing Saturday, Pence asserted, "We want to remind Americans, as Dr. Fauci will emphasize in a moment, if you don't have symptoms, don't do a test.
It is another way that the American people can make sure that we are preserving the resources that our healthcare workers need to minister and support those who are dealing with the coronavirus and other illnesses," he continued.
Mike Pence just said, "Don't get tested if you don't have symptoms," and then 2 sentences later said he and his wife don't have symptoms but are getting tested. "These people are not looking out for us," Twitter user, Maybe Marbles, posted.
Journalist Jarrett Bellini also expressed his ire at the situation.
Tonight, Mike Pence and Karen Pence both tested negative for coronavirus. However, relief was only short-lived for the vice president after doctors informed him that, unfortunately, they did find trace amounts of empathy, he tweeted.
The office of the vice president did not immediately respond to a request for comment on why the Pences were tested.
The vice president's press secretary Katie Miller tweeted the results of the Pences' tests Saturday night.
They came just hours after Pence announced earlier in the day that he and his wife would be tested for the virus, but only out of an abundance of caution, claiming the staffer who tested positive did not have close contact with either himself or Donald Trump.
Pence said his staffer was doing well.
Still, he stood a few feet from the president at the podium during the now daily Coronavirus Task Force press conference Saturday afternoon.
"If you can't get tested for coronavirus, the easiest way to find out if you have it is to cough on Mike Pence or Karen Pence and wait for their test results to come back in 5 minutes, a Twitter user sarcastically quipped.
Many Americans have revealed they were unable to receive testing even when showing symptoms, and others who were lucky enough to get tested have complained it has taken them up to a handful of days to receive the results.
Speaking about the staffer who had shown symptoms for COVID-19, Pence said Saturday, "I'm pleased to report that he's doing well. He had mild cold-like symptoms for about a day and a half, has not been to the White House since Monday." Even though Pence reinforced previous statements that he and Trump had not had close contact with the infected individual, he said he would take a test due to his prominent role in the nation's response to the outbreak. "Neither the president nor I had direct contact with that staff person. We worked immediately with the White House physician and the CDC. We've done all contact tracing and the White House doctors indicated that he has no reason to believe that I was exposed," he said. Pence's announcement that he was getting tested came just moments after he told the rest of the American public, "Don't get tested if you don't have symptoms." He told people to save resources amid ongoing concerns that there are insufficient tests for those who may need them. Pence did not mention that he or his wife had any symptoms. He has appeared at Trump's side daily at the White House press conferences to announce developments in the U.S. fight against the outbreak. The vice president's office confirmed that one of its staffers had tested positive for the virus on Friday. Pence's press secretary Katie Miller said, "Neither President Trump nor Vice President Pence had close contact with the individual. Further contact tracing is being conducted." This was the latest case of coronavirus to brush the inner circle of U.S. leadership. An attendee at a political conference last month featuring Trump and Pence tested positive for the illness, and multiple political figures who regularly meet with the president and vice president have gone into preventive self-quarantine. Trump tested negative for virus last week. He had agreed to take the test after coming into contact with several members of a Brazilian presidential delegation visiting his Florida resort who have since been found to have the virus. Saturday's press conference came just hours after Trump tweeted the Food and Drug Administration urging them to speed up approval for a malarial drug and an antibiotic to treat coronavirus patients.
Hydroxychloroquine and azithromycin, taken together, have a real chance to be one of the biggest game changers in the history of medicine, Trump wrote in a tweet on Saturday morning.
The FDA has moved mountains, thank you. Hopefully they will both be put in use immediately. People are dying, move fast, and God bless everyone. He continued.
Trump noted that H works better with A, referring to the drug combination, and cited a small French study published in the International Journal of Antimicrobial Agents.
The president tagged the FDA and FDA Commissioner Stephen Hahn in his tweet, apparently urging them to action.
An FDA spokesman did not immediately respond to a request for comment from DailyMail.com.
The French study, carried out on 20 patients earlier this month, is highly preliminary and was non-randomized.
However, it did find that 6 patients who received a combination of hydroxychloroquine and azithromycin had their viral load reduced faster than those on either hydroxychloroquine alone or neither of the drugs.
Hydroxychloroquine is a high-power drug used to treat malaria, which is a parasitic infection, as well as some non-infectious inflammatory diseases such as rheumatoid arthritis.
Azithromycin is a fairly common antibiotic that is used to treat a number of bacterial infections, such as strep throat.
Neither drug has been previously indicated to treat a viral infection such as coronavirus, although there were anecdotal reports of hydroxychloroquine being used successfully to treat SARS, a close relative of coronavirus.
Though both drugs are common, with side effects that are well understood, the combination of the two drugs is novel and it's unclear what interactions they may have.